Hello and welcome back to Gastrovision. I'm Dr. Qazi Suhail and today we will discuss an exciting new therapy for Crohn's disease, Risankizumab, a selective IL-23 P19 inhibitor. Let's start with the science. IL-23 is a pro-inflammatory cytokine that plays a central role in Crohn's disease. It is made of two subunits, P40 and P19. P19 subunit is unique to IL-23, while as P40 subunit is also a part of IL-12. Interleukin-23 stimulates Th17 cells, which release powerful inflammatory mediators like interleukin-17, interleukin-22, and TNF-alpha. These cytokines drive chronic intestinal inflammation and mucosal damage in Crohn's disease. So what happens if we target P19 specifically? We block IL-23 signaling and the Th17 inflammatory cascade, but we leave IL-12 intact, which is important for protective immunity. That's the key advantage of Risankizumab compared to older biologicals like Ustekinumab that block both interleukin-12 and interleukin-23. That is the key advantage of Risankizumab. Then let's look at the evidence from trials. We have advanced trial, we have motivate trials. For Risankizumab, these were phase 3 induction studies. Patients with moderate to severe Crohn's disease, many already exposed to biologicals, receive Risankizumab 600 mg IV at weeks 0, 4 and 8. At week 12, significantly more patients achieved clinical remission and endoscopic response compared to placebo. We have another trial for Risankizumab, that is FORTIFY trial. This was the phase 3 maintenance study. Patients who responded to induction were switched to subcutaneous Risankizumab, either 180 mg or 360 mg every 8 weeks for up to 52 weeks. And results showed that Risankizumab maintained remission, both clinical remission and endoscopic improvements, much better than placebo. Now, what about head-to-head data? More recently, Risankizumab was compared directly with Ustekinumab in biological experienced Crohn's patients. Results showed Risankizumab achieved higher rates of endoscopic remission and mucosal healing, suggesting it may be more effective in difficult to treat cases. In clinical practice, at around 12 weeks, most patients achieved clinical remission and biomarkers like CRP and fecal calprotectin dropped significantly. Both trials and real-world data confirm risankizumab is effective and well tolerated in Crohn's disease. In terms of safety, risankizumab is generally well tolerated. The most common side effects are mild upper respiratory tract infections, headache, injection site reactions. Serious infection risk is low. No new safety concerns have emerged in long-term follow-up. Importantly, because it targets only IL-23 and not IL-12, it avoids some of the broader immunosuppressive effects. So, to summarize, risankizumab works by selectively blocking the P19 subunit of IL-23, that's interleukin-23, shutting down the pathogenic Th17 pathway while sparing interleukin-12. Major trials like ADVANCE, MOTIVATE and FORTIFY show clear efficacy for both induction and maintenance of remission in Crohn's disease. Real-world data confirm these benefits even in patients who have failed other biologics. This makes risankizumab an exciting and promising treatment for Crohn's disease patients worldwide. Thank you for watching. See you in the next video.